Welcome back to the MGNet Minute, and sorry for being absent for a while. We've gotten some inquiries about seronegative myasthenia gravis, and so let me tell you a little bit about this. So about 80%, maybe more, patients with myasthenia have a positive acetylcholine receptor antibody test. Then maybe 8 to 10% will have muscle-specific kinase MuSK antibody tests. There's an LRP4 antibody test, but I and several of my colleagues are concerned about how well it works to diagnose myasthenia. And so often, for patients with LRP4 antibodies, I move on to obtain an EMG test, a repetitive stimulation test, or a single fiber test to confirm the diagnosis. So technically, seronegative patients are those who don't have any detectable antibodies. They have the clinical presentation, and that's very important, that their symptoms are consistent with myasthenia, and the neurologist can find abnormalities on your examination, generally so. And nearly always, one of these EMG tests will be positive. In other words, it will show signs of myasthenia. I think it's exceedingly rare for a patient to have the typical signs of myasthenia and have negative electrophysiology. To make that diagnosis of seronegative myasthenia, one caveat is, over the course of my career, I've had patients that I can tell in the examination room have unequivocal signs of myasthenia gravis, drooping eyelid in front of me, slurring speech in front of me, the typical patterns of weakness, and yet an expert electromyographer doesn't identify a defect. I hope that's been helpful. I'll tell you what, I think seronegative myasthenia is particularly challenging for the patient and for the physician to diagnose. If you don't get satisfaction with your first neurologist, feel free to reach out to the Myasthenia Gravis Foundation of America or your country's MG societies and find an expert to see you. Remember, some patients with seronegative myasthenia or myasthenia in general may have other medical problems that produce fatigue. And so you should work with your primary care neurologist to identify those too.